The Health Professional Council of South Africa is intensifying its effort to clamp down on the rising illegal medical practices. In the latest breakthrough, a female Congolese national was arrested after she was found practicing illegally as a locum at a medical facility in Johannesburg. For more on this and the Council's efforts to root out this scourge, I'm now joined by David Mametja, Head of Core Operations at the HPCSA. Mr. Mametja, good to have you, and thank you very much for your time. The Registrar of the Health Professions Council of South Africa, Dr. Masike, praising members of the Inspectorate Office, patting themselves in the back for a job well done. Let's talk statistically now in terms of the numbers as we sit in 2025. How many unregistered individuals pretending to be registered practitioners have you uncovered, and how many do you suspect are still in the system that needs to be investigated?
Firstly, thank you for inviting us and giving us the opportunity to come and speak to this important matter. And indeed, I'm here to represent the registrar. And yes, we are seeing an escalation in these types of investigations. And remember that we do it proactively, but we largely rely on members of the public, those who interact with practitioners, whether they are legitimate or bogus, where maybe there might be suspicions, and then we'll go and investigate. And just to give you some numbers here, because you asked for that information. So we, in 2022-23, we had 1,987 of these kinds of complaints that led to investigations. And that number increased to 2,727 in 2023-24. And in 2024-2025, we recorded 3,528. So you can see that it is an increasing problem, which has now led to our inspectorate having to really work flat out to go and root out people who are practicing illegally and illegitimately.
Is this an indication that more people are now reporting these criminal acts as opposed to what you would have been seeing 2021, 2024, 2022, 2023?
Indeed, that's correct, because I think we also have embarked on awareness-raising activities to inform the public about the possibility of their being subjected to persons, and it's really about their lives here, that are not supposed to be, even touching them on anything. And as a result, there's been a spate of these complaints that we are receiving, and we are thinking there is a correlation from the awareness campaigns that we have conducted and the increase in the number of complaints. But I must just point out, by the way, that we think there's still a lot more out there, and it's just a matter of resource constraints that we are not able to cover the country as we should. I mean, we're talking about 10 inspectors, that are assigned to do this almost impossible work in all of our 9 provinces. So if you're just talking health establishments, where most of the practitioners are, we know that in the public sector, if you just looked in that space, there are over 4,000 establishments there. And in the private sector, more than 200. But then there are also, your small scale, general practitioner in some corner out there. And to have to be checking on all of these only with 10 inspectors, obviously, there are some limitations in terms of what we are able to do.
Is that the reason why it would seem that probably other institutions that are acting with impunity. I mean, almost others saying, well, there's no consequence management. If a Congolese unregistered individual can be in a system in Hillbrow since 2023, only discovered now, one, it means, yes, that individual is acting fraudulently, but the facility itself would have allowed that unregistered individual to continue there. Is that what you say? Because of a lack of inspectorate that are able to check these things?
Yes, we don't have enough inspectors to cover the entire country. And of course, in some instances, maybe these establishments might not have been able to decipher, that, a person seeking to work in their establishment does not meet requirements to practice. But in some instances, we think it's deliberate. There's an issue of locum practitioners. So they work under registered practitioners. So, either to alleviate the workload, or maybe when those registered practitioners are not available, then they will rely on locum practitioners. And we think in that instance, that's where maybe there isn't proper practice such that then you can have an illegitimate person having been brought into to practice at great risk, obviously, to the public.
Scarcity of resources that you're pointing to, and the registrar drawing parallels between practitioner concerns, but also the concerns around illicit medicines. Is there a relationship here that can be curbed by resources, that can be curbed by boosting particularly the work of this professional body?
Yes, you're talking about substandard and falsified medicines, which, substandard are like, they might go through the normal pharmaceutical production processes, but something might have been wrong in terms of, whatever, products or chemicals had to be used to produce, the required medicine. But then there are those that are done in backyards, and there is an intention to produce those illicit medicines. Although I can't speak to a specific research that has confirmed this, we think there is a correlation. A registered and professional and ethical practitioner is very unlikely to be prescribing medication that has not been signed off by our health regulatory products regulatory authority, SAPRA, in this particular instance. But those that are like outside of the normal sphere of regulatory control, are in a position to do as they please, because in that space, the intention is really commercial. It's not the well-being of persons that are being seen by those practitioners.
What is likely going to happen then in the future in terms of this intensified collaboration with law enforcement as well as regulatory partners?
Well, the good thing is that there is already that collaboration, in particular with the South African police services, and the Health Products Regulatory Authority. We conduct some of the inspections together with them, and we have had instances where these kind of illegitimate practices have been unearthed, and there have been consequences. People have been taken through our legal frameworks, and they've been found guilty, and some have been imprisoned, some have been made to pay fines, and in some instances, it's usually 1 year to 5 years imprisonment, but we have had instances of prison sentences of up to 20 years. So working collaboratively, seems to be the right way to go for us.
Yeah, talking of sanctions, and as I wrap up, let's segue into this. And there's been some backlash about a sanction that you've recently meted out to a professional who is also the UN Health Envoy on her online activity. Is there an explicit legal ban on, for example, profanity or on professionals on their own individual platform? Does it form part of their professional conduct?
Well, this is one particular matter I would not really want to go into depth because, there's been additional information that has come through. And by the way, the affected practitioner is also entitled to seek an appeal against the sentence that was meted against her. So we have to see what comes out of those processes. The only thing that I'm prepared to say is that we as a regulator have to abide with the provisions of the legislation, the regulations, and the policies of the boards. And these are intended to be standardized, so that we can be consistent in how we handle practitioners. So that you are not seen as having handled one matter different to another matter. And that's why we try to stick to the rules. And this particular matter, obviously, it's about contextual issues. And it's very difficult because, contextual issues are infinite. And it's very difficult to even predict them. So when you have to work or conduct yourself on the basis of the laws and regulations, it's very difficult to accommodate contextual matters. Yeah. But I'm sure it's a matter that we will look at as the HPCSA, and I'm just talking generally, and not so much specifically about this case.
Let's keep it there. I mean, in broader terms, is there a sense from the rules and regulations as prescribed by the board that are able to link yourself as David Mametja and your professional identity to what you do on your platform?
Well, our law, the Health Professions Act, and some of the applicable regulations, and the ethical rules that we have, requires of practitioners registered with us to conduct themselves in a particular way. Issues of decorum come in as well. So in instances where a practitioner is seen not to have, adhered to those provisions, that's when then, a complaint can be lodged, and we are required by law to respond to those complaints as and when they are lodged with us. And the only way that we can deal with them is through what the law says and the regulations that are applicable.
Mm-hmm. And of course, the matter being challenged means that the yardstick that is being used now will be measured against all sorts of other variables, including moral conviction, including political views. I mean, does the scope of those regulations extend that far?
Yeah, you see, unfortunately, we don't have the laxity of what happens in a political environment where maybe there is much more flexibility. Just as an example, we had a couple of Palestinians arriving from Kenya in South Africa. They didn't meet requirements for entry into the country. But because they were being managed in a political context, arrangements could be made to deal with them. Now, as regulators, unfortunately, we don't have that kind of flexibility. We are required to stick to what the law says, the regulations, and as I've said, the policies that are articulated by the professional boards that are responsible for these matters. But again, I'm still saying, there can be conversations on this going forward, and we'll see what comes out of it ultimately.
Mr. Mametja, I appreciate your time. Thanks so much for coming on. That's David
Thank you,
Mametja
Master.
there.